Hi everybody, I'm Dr. David Reath, and I'm here with my nurse, Jill Mays, and we're going to talk about this week's Truth-O-Meter Tuesday question. It had to do with a topic that's sort of been on some of the TV shows, Housewives shows, and it had to do with the so-called liquid facelift. And the question was this: you can get the same results from a liquid facelift that you can from a standard or surgical facelift. And the answer is pretty much on the false side of the spectrum. And I think fillers are very good, but they're not a facelift. And there's a real place for each of them. Jill, what's your take on all this?
Well, I absolutely love Juvederm Radius. Love them with all my heart. I can fill in a smile line with them. I can plump cheeks up, add a little bit of lift. But no, I cannot do with a filler what you can do in the operating room.
And I think what I'm doing with a facelift is I'm repositioning tissues which have moved, sometimes removing skin, but the real foundation of a facelift is moving facial fat back into positions it used to be in. With fillers, what we're doing is somewhat of a camouflage work, filling in some things to make it not look as obvious, and there's a great place for that. But I think it's wrong to expect from fillers, as Jill said, what you can get from a surgical facelift. And there's an issue of cost. The people that are doing the so-called liquid facelift are probably using somewhere between $4,000 to $5,000 worth of injectables, and the problem is it doesn't last forever. I mean, people ask me all the time, how long does a facelift last, and how much rejuvenation do you get out of it? And I think most people will say that for a facelift, you probably turn back the clock about 10 years. Well, that's a lot longer lasting than the injectables you may get. And the other thing I'll just mention is that it's important when you're considering facial rejuvenation to see somebody that has all these tools at their disposal. If you're seeing someone who only does injections and doesn't understand what can be done surgically, then all the options are not available to you. So it's always my best recommendation. You see a board-certified plastic surgeon who knows when to use what, because sometimes you need a little bit of both. Anyway, enough of that. I've rambled on a little bit longer than usual, but let's find out who won this week.
Britt Winters.
Britt, congratulations. You're this week's winner. You get a $100 gift card. Come on into our office and pick it up. Thank you everyone else for playing. We'll come up with another question for next week.